Me magana de shema menina ajo emamo akwaba enyumri edeba Adoa TV Health Matters adwumedie no ene braso se mede esommo na se ne monimu no edru dwoda se die na pomudi ho komo no ifduem haya ene ye betwetwe no ene te pawo kame ho na yensua de ene akoye adwoda eye December bosomine de toso du nwotwe e won fimpi no ene aduro no miensem enkakra na free January ede besi December mu obo ade nyankopon ahwe yen so obo yen ho ban ode yen ekọ asan de yen bada bia techema edabodwe moja edi yemu afurusane na se ene December atome no mienu aka enefo kakra bi na chese 31st edru na yakwa akoja 2023 ekwan ama ne kokra kanachi na yera 2024 mu na wote ase wumuye oso wo mfaso ede ma Kristo dia asedanko a ene de matwe de ampo Nyankopon asemu a makan se ugitum e wo fie ana ba bia wo hwe bibia na ka se amen e fa ma me mera se waje pene no ka se amen ne chese enye ho emfa ma ye nyina na ene ye nkomo no eye tiawa eye de na ye besua de soso e de afri mu mempa se metse wo mre se wo hu enti no ye be twa ye hu sima na yakoje aboafo nkrato ye ba ye de nkomo no ebe hihye so ana se topic no be hihye so ana ne ne ye be kasa e de afa ho eye mitral valve stenosis and heart conditions. Aha, say medical terms. It's a do baby and I say, and then me say a total fast ones. My aunt, my boy, I know doctor will feel no church, so no topic in the mind. Me, I'm a better you made so na me demo a chair, near the year, dear Madimo Kyeamehemaa, me de at the Kyeamehemaa Adwoa Asaah. Me chame who see my bar in the common canning of a so at the amount, but I say.
Lovely people, this is Lovely Smile with Sonotic. I am Dr. Ifeoma, your dentist, and we are proud to announce that Sonotic Dental is 1 year old. Hooray! In view of that, we have special packages for our clients. You want to be our clients this month of February? Come around, we are waiting for you. The first package is free toothbrushes for our lovely clients who visit us this month of February. We would want you to have a lovely smile this month and beyond. The second package, watch out our neighboring schools. We are visiting you for an outreach where we'll be taking care of these lovely kids. We'll have a free dental outreach for these kids, diagnose any possible condition that needs treatment, give the necessary referrals, and then have a lovely time with these kids. The third tip, which is very important, is that we'll be giving out educational tips on your oral health on our social media platform. So watch out for these special tips for you. Thank you very much and have a lovely day.
so Emma Kwaba Bium Edeba Adwoa TV Health Matters Jumede no ena when go so we hwe na ene many kind about topic ne so mitral stenosis and also wetimi atwa ne short na MS and I say mitral valve stenosis and the heart conditions eno ne yebe twetwe ho nkomo na ene ye doctor e wo fie ha no mo Dr. Philip Opi e wo fie ha a obetwe yen enema bebre e dey afam me mu see e be di Christmas enche lifestyles bi e bi besuasua nema foforo bi e dey aka omabro a mbefa e dey aka omabro abo ho e bi nso be free omabro abo dada na enye ne ho lifestyles bi no ho e bi nso so e be ye omo ho e ka na say ceremonial people a omo no afeso ana omo fa sa abrabo no e ka omo ho na afi e dey ohaw bebre aba beto omo so enu nte na doc wo fi ha say obetwetwe yensa na eme nyina eye MS yi ne fare by kwan ye befa so behwe ye hu yi anase bebo ye ho ban free sa yare ne ho ene kwan ye befa so a se ne wanya bi mpo no obetwiti ne ho ti ne nyina no doc e wo fi ha say obetwetwe yen na ye nyina yesua ti be pa wo chofa wo phone na frɛ obi no doc obi phone nua bi se bra so sa apomode ho nkomo no okay homa yesua de e wo fidua mu aya eye Adwoa TV e na wo hwe dwumedie pacho ye twa ne live and say ye hwe ne live e wo Facebook into ko Facebook a eye Adwoa TV Ghana Adwoa TV Ghana okwa Facebook junction ne so ho a na wa mia like na wa mia share na fe waja comment ato ho no mo na fe ya to ye bo na abeyi wa no kama emre pa mabie phone lines no na fe me de WhatsApp and SMS number nso so atodwa se ne be ya obetimi asende o messages nso so e de abanama kenkan e de amadok na fe wa yi ano e de amount me pa ucho ye nyina yenye akomakro na ye ntena se na ye ntie ne ye mfa bi ento ye nkotodwe mu me mpese mekasa pie no ma se emre no ye nkɔ ne komadok akwaba na efa nkomo no enhyehyɛ so dok mo akwaba
Joso.
Look, ye twa ye wie afe no. Nti wo wie a ye wie kwa betu yenfo afa aduane die ho. Menim se ensam no de bebre but ye nkɔ ho no mo sare be ba no he ya ale. Aha. Iti doc ye say MS and I say mitral stenosis. As a chirepa and because of ya e wapa who study a me body no craft fiti asene kra na me funfun e ya motem sin teacher ya say
that's it. It's here with you for I'm say see a mitral valve stenosis na say see be a stenosis which means adibia narrow and funny say ahamaye what the he mo atwe saa ma aye ketekete aye very tiny nti won say yes me you see earpiece saa na na be some small ketekete so it is narrow but as I say uses that word narrow in medical terms it is stenosis.
Okay
na onu say kan akumayare heart diseases am for kan ebia BP stroke heart attack heart failure maybe angina dey see her but there were over 2,000 heart diseases
over 2,000 wow
because yare akunipa cause as so we pa heart diseases yes into heart disease akoya yare how will you know say you have a heart disease into mostly no almost as munya BP na the margin na to BP so mo akumayare be na won say BP that's not the solution, that's not the end. Wo akumayare yes majatum akumayare ben na you catch say em na wo so because every heart disease e wo only modality of treatment.
Okay
nti untumi fa angina treatment enko treat BP won fa stroke treatment enko treat angina nti a way out. Na you see obianya mitral valve stenosis akoma na wo ho no e chamber e wo 4 main valves.
Okay
Mitral no e one type of a valve.
Okay
Your tricuspid valve your pulmonary just say lungs no valve.
Okay
And afi your aortic valve nti akoye 4 Into question now, and then we have all taken only one out of the four valves. Yes, out of the four valves. No. Now, if you menstrual valves, no, you have stenosis one same. You have other diseases that are related to the menstrual valve now, but and yes, stenosis.
Okay.
And say, Uko Hospital, as a doctor, catcher will say, we are running to say when your menstrual valve stenosis are. Menstrual valve stenosis, akola odani mamiyum otuminya.
Wow.
2 years, 3 years, 4 years, 5 years, 6 years, 10 years, 20 years, 30 years, 70 years will be able to mean menstrual valve stenosis, a heart condition. But how to determine, say, Kyeamehemaa Adwoa a menstrual valve stenosis, no? That is the question. That's it. Into the labs are here, say, be a echo, ko electrocardiogram, and ko chest X-ray. What price no more? No more lati. No say where the meniscus. You don't know. Menstrual valve stenosis. So far wakuma na. Akuma no. Nipeduane esio nyina no. You hear one thing to make us move. That is the blood. So the blood is like a fuel of a car. Okay. No fuel, the car cannot move. Inti say akuma no pe pompe bladder. Your left ventricle and the right ventricle. That is the chambers of the heart.
Okay.
Inti minuti hey say akuma no bom moja no say kim say no. Ti say entumin fa through sa valves no na entumin distribute enko do ventricle no na fe and distribute moja no ema the body.
Okay.
Under no circumstances should blood not be distributed to the body entirely. You know, so we have something called a flap. A flap akoye adibia to make move up and down. So flap in medical terms, no you liftlet. Liftlet akoye say paper ya yen say plane na nkola omutu na ebie no. Nti ebie na mamuja no afamoko, so it closes and open. Close into minuti hey. When the valve, mental valve say ebia na kabum na muja no ko na eba. It shouldn't happen to you or me or anybody for blood not to flow through that right direction. Akwai say nsuo. So be a pipe. Na say rubber na odi see ase no anko gum direct na say gu nchen a hobe fo. Yeah. And say akoma no pompo muja no na say muja no antumi amfa mental valve no. Na say afi my body no and to me enya complete blood supply. Your body will be reduced with supply of blood.
Wow.
So blood supply no back from say the part of the body that will be lacking that blood no. So 1 and 3 years it can give you stroke, heart attack, heart failure, and it can kill you.
Wow.
Yes. That is what we call a menstrual valve stenosis. It's a valve issue. Senior car, the valves, to make us say, fear be me a copy pamon. Sounds na menstrual valve, and to me be and come boom. Say a yes, and I say a close, and you say a close, and I say to me be a. Then the heart's supposed to pump the blood extra. The sack man and ye jumano more. Then to me, mamojano and flow. Akumano equa side already know the valve is narrow. Ayetia into mojano be forced to pass through it. As a result of that, one year, when you want stroke, when you want heart attack, when you want cardiac arrest, you can die. It's a serious issue. Into heart disease is not BP, only BP and stroke and angina. No. You have several of them. So it is very important. Say, when you have symptoms about the heart, you go to hospital for you to be able to detect. Say, oh, this is what is wrong with you. So that's what you mean by menstrual valve stenosis. The narrowing of the menstrual valve. That's all.
Wow. It's not eno sano. Then na obi betimi aye. And I say nipa be de obi be de hu say menya bibi say.
Untumi entnase and determine say menya menstrual valve stenosis. And until na dey me can say in the treatment of disease and in the health sector, it is a law. Ignorance is not an excuse in any part of creation. So uko to ejema, we are kwalao, we are penio, a show. It doesn't know anything that way. So mitral valve stenosis, how will you know? The only way you can know is say if you are an experienced physician. What check will BP a number. But you are posing some kind of symptoms. No, so okay, be a echo, problem na mention. Out of the echo result, nobody said no. Nipa way na kuma no boy. As a result of that, the better determines okay, maybe this is what is wrong with you. But I mean, when you say some of the symptoms of mitral valve stenosis, they say one, you'll be having shortness of breath. Who means so? Now, also name say Ghana ha your way. Aqualebia who means so I the asthma. Or penibia who means so I the asthma. Now I start say offer asthmatic. So the more you are taking a wrong medication for the condition, the more the condition is gradually worsening. As I say, it's getting worse because you were not able to dictate what is wrong with you. And yes, shortness of breath via and asthmatic symptoms. Some are as a result of heart diseases. Okay. 2, when you cough, you begin to see blood in your cough. Ghana ha, o nim na se muso kan na o bo wa na se mo je nemo e be se tuberculosis. E be quarantine what we say here. But symptoms of mitral valve because the left atrium any right chamber no nyina no. Se moja no fema because I am narrower, moja no to me enko no na aboa no in the left atrium no. Into nim na ba pulmonary artery nti wonnim na so ubio ano se ubabo wape na moja no poa de kan ba nti we say no na ye say oh onya bo wa no ye ho moja nti no or tuberculosis TB and I say wanya serious cough na the command say samangwa na your offer. 3, you begin to get swelling of your feet and your ankle. Ghana ha mo opinion wanya from 40 airco ni 9 ho no na ye shen. You say a kidney problem. Do you see where the problem is coming from? Into an unexperienced physician, Bebster say no lab result, nothing, no or mao kidney prescription drugs. Until say one day, a doctor said back say coronary kidney function test na me share. Na run liver, oh yeah, everything is point, and nothing is wrong with you. Don't say Call cardio department koye echogram brem na menhwe and I say try chest x-ray and I say koye chest cardiac MRI. During that time no and obe hu say okay sa nipa way na is about the mitral valve but not
the kidney.
No. 4, oye juma kakra o see is what can be that you see you call jogging. I started jogging now. I said, "Oh yes, no. No, na kuma no about Kim. No, I come baby atina. My brother, my sister. And yeah, exercise now. Oh, you're not na kuma. Boss, you are having a heart problem. Go and find out." As I said, if you no heart murmur, in the boss, no. The more you try to do, the more the exercise, the more the heart is beating.
Wow.
As I said, into no, and no so. And then we have chest pain. Obo be ya we ya ni so obo ya we ya na bi mo say o kodi ginger e be ya moja na aba poapo. You see, those are some of the reality when it comes to
me chawando because I catch yourself bobo chest.
Thank you.
Number of times.
You see, so heart diseases is the leading cause of death because the ignorance aspect plays 90% of it. Nti obe we never say then e kono e be a true autopsy never say oh na say nipa ways na or mental valve issue and I say oh this kind of heart problem na fe it's late you know so question there.
Wow. It doc yeah share sanya mental valve ya say me a wo kanyina aduane die ebetimi ekoso ana de important e de sa menstrual valve stenosis no eba.
That's it. Menstrual valve stenosis. Into me come from beginning say bi mu wo ho a akwala e wo ni ma me from put to me. So it tells you say some are as a result of genetic factors.
Okay.
A genetic factors. Into ebusian bi wo wo to me kan o ye de me na o BP. Na ni anka o BP. Ni papa benya BP. Ni anti ebusian genetic factors. And after so the diet comes into play. So there fatty food, this is junky food, and one all the anapa 10 o'clock or the rice beer oil 10 is to say. I mean, what do you expect? These are some of the beginning of heart problems. Into where this are for say on antika cross in my bread, on antika cross my bread. Now so your bar, that's a sudden start here. When you get pregnant, that is when the symptoms begin because pregnancy goes with a lot of pressure on the heart.
Okay.
You know, we say man will be only saying we are not going to eclampsia. After also no me be me we na me that say one open one the aba so
I say no ko bi wo ho a onya sa ne ma we nyina but still no owu wi a no onya that mean say there are other conditions it me ma apart from we na.
Yes. And I mean, obi wo why be a genetic issue. In the one you know, after na eba into reality. Obi so why during pregnancy no e be some medications and some treatment will go through no. And no e ka ho. And then the worst aspect of menstrual valve ni say ya onipa bebre e wo kana ha na say was association no. We have something for strep throat. What one no was
no quite
me me ya no akoto streptor na de bia water streptor no a bacterial infection that causes a disease called enteric fever. What is that? So enteric fever no is a bacterial strep throat in the cause. You know, some bacteria now can stay within the lungs and then the heart. No, as time goes on, when you know, no bacteria no damaging menstrual valve. No, what I say, you know, if you are there's no disease that comes as a result of miracle. No. No disease comes out of miracle. Every disease has a cause. Neither it is genetic, neither it is from your diet, or neither it is through what you drink or what you smoke. Simple. And that's a bacterial issue. But sometimes because bacterial virus issue, I don't blame so much because will be take care more be in home baby so those ones sometimes I don't blame too much. But something like menstrual valve will be for more be and you're contaminated will be for more be. Be like diabetes, be for more. Just a walk of far. And they
say no, lifestyle be and
yes, most of them are lifestyle, and most of them are genetic. You know, so genetic service be only me say a Busian way. Obi a young school, my own to go to do it. I meant to know because I only was out from Munjaya. So leave them and go and stay somewhere in Bobra. But Munjaya was in my Bobra uncle. And the only say a Bushan way, you see diabetes or Mupara, meaning there is something they are not doing wrong. That is triggering their diabetes symptoms. So try to find out and avoid it, and you'll be found out that you will not be part of their problems.
But okay, to say Obisan fine, we're free Ebusia like on count home, what's in a home, but Nedidium.
Yes.
Personally.
Yes.
And so betting me, I know so betting me they are share set because a year Ebusiano it runs in the family name. So no kwala kwa fa bakra na. But the best Ebusiano the line in one.
They be you see. Obey then na one who say me na me did na me ko fire we buy. Ebia wo nim say wabusua no ya what da say diabetes for wo mu pa na say usu nim say diabetes chiri too much sugar any anajo didi na once the dem will say one can no grandfather na ye kan no 10 o'clock to make the fufu na the other you don't go through you don't follow the same trend, you try to exempt yourself out of it. Your colleague will be wa ni papa de mami petit but no what he said too much of those milk and no trigger or say mean only a problem maybe because what you mean
okay
what I say so acquire say something that it is there and you involved yourself into it and it is disturbing going you know what I mean say me the blame how because I
it's not my bro pizza say see wuni
Cameraman, look at me very well.
This is your camera.
Some culture will say, since I was born to today, I know can say, Mindy pizza that I will believe it.
Wow.
Oh no. Ah, why will I eat that? I will not eat it. Dab.
Oh.
Now more gram num be that. More gram num
milk.
Tea me num.
Oh, I know some people minimum coffee.
Tea me num
milk.
Me num tea. I don't take tea.
Oh no.
I don't more Fanta. Those I don't take those things. So how more pizza? Pizza don't go there. Hey. No. But say 90 years now I should be able to satisfy my wife.
Oh, it's possible.
It's mean Chema. Yeah, there are so many men in town right now. 30 something, they can't do anything.
They are depending on aphrodisia.
And also they are prepared for heart attack. One day, fire now. I see straight to the mortuary. I don't want it. You see. So, me go deal with any product to go and cure disease for myself. I won't do it. So there are so many things I don't eat. When they give it me, I will not take. Yes, seriously. I'm telling you the truth.
What's that treatment for, sir?
Mental valve. Mental valve has two main treatments. One saying a plumbers, a toilet sink, a pipe, and all this tube shemuno. At the surgical department, that's how it is done. Because a valve, no, not that say a MWC. So they need to remove the valve and fix in with, which is done by the cardiologist and then the surgery. That is their part. But the next part is you watch your diet to sustain you. And yes, I catch you say if you ordinary BP crab, you catch you say BP crab, so we call oil level, I'm you will die. So how more a mental valve? So the doctor will tell you say maybe giant way, men the way, men this citrate too much, men stress you have enough rest, do this. That one contribute a natural treatment, natural way. Before maybe if surgery is supposed to be conducted, I find that one there is between you and your surgeon, and there is there. But say continue no being cancer will say Yankupon be the match of Mr. Yankupon doesn't treat mental valves.
Ne miracles of outside. It is not what I anybody I care, but maybe said and said what can a bang like a type bang like a granite saying Abia. Body and PC, Nikontum Remeko, and a contum refro, yeah, Nabia, and walk a crowd and I say, yen winning free one, and I say, a young corner, a banner, Abia, soft drinks, yeah, Abia, yen home free, carbonated drinks in Abia, and local drinks, and also, so how do we go about it then?
You see, I want Ghanaians, Africans to understand, say, your genes and your genome is African made. When you try to inherit or learn the culture of the whites and start to eat what they eat, please start to expect their diseases. Start to expect it, because formerly not this in the ratings of Hippocrates, diabetes in him. There are some diseases that were not there in those ancient days. About the same as I say, Africa be far almost American for obesity, or diabetes, or cardiovascular disease. No, I bet you now so if I say akwala ya won in or heart problem. What causes it? But the amazing thing is that when you go to the villages where they eat the contemporary, they are them, and those things they don't have those things. The man one who say ya come with a crisis ambulance more pure say where they say your kidney problem here didn't call Kolebuda and see. Or if you cry say better in Bantu Accra, now when your problem no Accra. Why? Because when you leave your plantain, your cassava, your fufu, your benku, your akple, your consume your things and start living the white man style, please start to be expecting the white man disease.
Then you start who best start as a visca for?
Yes, of course. Into say the one that will take his oath in medical school and say Hippocrates. Or no, you're taking the oath now catching and say, let your food be your medicine, and your medicine should be your food. Are you telling him he's stupid? He doesn't know what he's talking about? If you are taking his oath, and I know culture will say, "Ma we do ania we do, no we do ania." What do you mean no culture no? No, on him because during those days there's no pizza. During those days there's no what.
There was a farm. A farm is made from
yes.
cocoa.
And me our local things are meaning. Our local drink are meaning pito. Any pan wine issue any sort ni mako. So yeah.
And I know mama typical local drinks.
Oh, palm wine, pito. Any sir, those are for we Africans. Asana. Those are for us. So midnight. No, nipa de koji be any winners in China. No, we be running for a doctrine of the number. And
I say investments at a year, no good living.
Oh yes, it's an investment because the hospitals. Who are you waiting for? We're also waiting for. Lawyer Bompire say. Carpenter ni Bompire say roof no linky. Adwoa TV Bompire say I'm from fire advert. So what do you expect from the hospitals?
Oh, they should send that way. So they should just send that.
First say, is there any client at the office? Say yes. It's like okay, I'm Kabi. So that's it. So cost it yourself. You see?
Wow.
The me can say. You are ready or what? So we are nipa na so but as we so no we a mistake. That's why you say you to me. If you are not careful, you will sell your properties. Your family will even reject you, and you'll be sad. You'll be miserable on this life. Baku, cancer. Baku, kidney problem. Baku, stroke. Stroke is part of the heart problems. Inti men fast anyamano. And they are grow and can say, oh, normal. Because people have tried it and today they are regretting it. In store building for the past 5 years, or full cut up with that.
Oh,
that form. So why are you doing this to ourselves? We have allowed the white to bring all the rubbish here. Now say, oh, wait, maybe fee how kohwa. So why are you patronizing them?
It's from the top.
Naturally, what did you do with me?
Doc, here are signs and symptoms.
Yeah, signs and symptoms. As I said earlier on, number one, who is so. We are Jumaka cry no abre. Ubo wa na moja na metire. Woni so breo. We are says and answer one and why a week. Why say me yare fatigue.
Me yare so mentiapo.
Yes, those things. But the issue is, how will the person know, say, I'm having a heart condition called mitral valve stenosis? That's the problem.
Unless
you go to the hospital. But here is the case, no. Hospital, no. You understand? So, and as I'm saying, I mean, you can say, you won't call and so ye. You're so fine, so much no bre. They are treating them with asthma in the house, whilst it wasn't an asthma. Your papa moa, the nayatata, obi man kidney drew, it is not a kidney problem. So that is some of the problems. So go to the hospital, run your lab test. Your lab test at the end of the day will tell you whether you will go to heaven or you stay on the earth. That's all.
Whether you go to heaven or you stay.
I say heaven, say who wants to work on heaven. I know what.
Me person me dane
When to sell her?
Enoch
Ben. Where to year? On the AC. Satan no achum.
Oh, but look, everything is possible. When you have faith, you pray and you believe, it will definitely happen. Oh, sure.
Some of us, no, you will be asking questions that when they
Okay, the person will be a part of this conversation. Pacho, maybe a full line, so no, Ede Atumu Amalti. Number no, 055-155-2211 and 055-155-2244. 055-2211-055-155-2244. And I feel WhatsApp number no, 0544-1335. 0544-133530. And both for WhatsApp and a normal text message and answer me a SMS no until patrol to me. Edo questions no I shall say abana fe makenka edi amadok wa we just have some few minutes to go. It's in patrol number ni biem phone lines na ye bia tum 055-155-2211 055-155-2244. It's in patrol ye twan na ye part of it. Is it doc?
Yeah.
Me can we nyina mana kwa akosi say ye be de Christmas yi. Se na me di kan no. Ebi mu ebe didi nieme bia ebedi Christmas ni be wie no na okofa yare no e de ato ne ho so obra onnim how a oye no so wa ye wie ye ka aduane samu yi parties e be koso church. Okay, hello Augustine. Uncle Oge. Hello.
Hello, good evening.
Good evening, Papa. Me pa cho ye ko yeti o.
Let me be say doctor omo hospital way.
Okay, yo. Obey ya no doc pa cho yi na no mame.
What was it?
I say o hospital, baby, mo hospital.
La Paz.
La Paz.
Oh, okay.
Okay. All right. Yo.
Okay, me that's it.
Miss me that say. Okay, hello 05515522110 055155544 you know 05515522110 05515552244 it's in a train calls no man I think some messages tripping in. Okay, where you say okay, so my name is Judita. How can I know I have this disease or sickness? Okay, doc, I can't what signs and symptoms be, but I know crown was so won't mean and no so now won't find and can say was I just say Wako Hospital. Okay. Hello?
Hello.
Me Pachodi.
Your friend and announce until we can suffer in that area.
Yo, Nana, me that say Pacho you.
Yo, whatever, ma. You see, in person, beside Dr. Kakra.
Me Pacho, Yankasa wa phone, you better make.
Menanti Kakra, na. Yo, Menanti Kakra, na, me bossy shimmy, sa. A shimmy. Se mi jina kakra na metwaswa na ejai kra.
Okay. Me pa cho start ya che.
Start be say 1 month ni.
1 month. Wako hospital there papa.
Start be 1 month ni.
Oh, if you say
Mako hospital eni kra punti. Ochina kra me pese me de kokole bu kohwe.
Okay. Me pa cho low TV volume no doc bi sa wasem tiawa. Iti u de tie no phone nim.
Yo, okay, me too.
Let me just say, but if you say.
Hello, Nana.
Oh, no, 57.
57.
It's no qua, maybe one
part no so.
And the best thing is palpitation is one of the symptoms of menstrual valve stenosis, but it doesn't come because excess uric acid, palpitation, gastritis, but palpitation. As well as the hospital, maybe the doctors are in the position to run those tests to see what is causing the palpitation.
It's another doc, me a doc, I can say, oh, it's not so be call hospital until we qua. Now we catch your one, almost only come me fast one, a dear man. Okay, me that say, okay. Hello? Okay. Ways to say, please, wow, also please, I want doctor's number.
No,
can he mention it for me?
No,
okay, Pacho.
No.
Okay, Pacho doc, yes, de what I say, WhatsApp number, now, me WhatsApp number, I'll frame me, me mount. Aye, me personally, me the doc number, no, mount. Okay, okay, the doc na make Christmas, omu some heart conditions be and some heart problems be after Christmas no they will begin having them a foot will be now they be mount.
You see, mommy, yes, one no credit pakope. Some of the diseases are ecosono, some they don't know, but sometimes I honestly say sometimes I blame the media.
Yeah, they say they
train. In European countries, we have medical journalism. See, he researched into medical issues. So, better than anymore, all that out. Catch me. From day one, what is diabetes type 1, type 2, type 1, type 2, we have diabetes type 1.5. When a doctor misdiagnoses a patient of diabetes type 1.5, I have a ladder or type 2. So the medicine will not work. Your body, nkola no mo ye fumo ya wo from 2 years ya mo diabetes. Omo dey type 1, type 2 ni bio. Understand? Into me wo condition no wo from the infancy. He doesn't know.
Okay.
Or you're totally ignorant about it. Into one, you know, one single aduane, the beko ni minimum maybe or 50 something years. Well, even a former minister. On a meeting, what we tilapia said team. We yeah, I'll just number and baby. Thank you.
Wow.
So you see, our health is like the work we are doing. One fat pin and share the right place, you will not hear sound. That's all. That's all. So conditioning that was like a better cost because this is the time they are going to eat anyhow, drink anyhow, smoke anyhow, aphrodisia everywhere.
They say the latest one crab is a laughing gas. Yeah, pumping gas, no, a good balloon. When you inhale, then you start.
My main class, I'm
laughing.
Intina, Papa B, is still something or say, Francis, something or say. A person who doesn't read is like somebody who is not educated at all. So I go school. Who a degree? That's a one kind of books. What is all be a one go school? Now say who degree, masters, PhD. Now say who himself shisha contain tar and a dear quota no. The dear quota. Yeah, the dear quota no contain carcinogen, different chemicals. That's a still you will heal it. You're not normal straight away. You're not. So be here at the book one as I would also what we educated. Education means that you are in a level to educate those who have not reached there. Then you say this in the but if the so called a blazer. Oh, the no that no say part of what girls no musician. Oh, feel cry no more call crash or no do one this answer. But those there don't do it. So even know. Yes, so that's how diseases are now being classified as rich and poor. The poor people, that is malaria, typhoid, Asaah. For the stroke, the rich in kidney failure, kidney enlargement, heart failure, heart attack, angina, sclerosis, prostate enlargement, prostate cancer, cancer of the throat, cervical cancer. Yes, the rich is for them, but the poor do not because what you are eating they will not eat. Now, nipa does any, or fast cigarettes, no our fancy. One room in sana, no one room cigarette. Only what you are doing, you are using the alcohol to dissolve the chemicals in the cigarette into your throat. That's how come they all get throat cancer. You are not normal. You are not educated. Whoa. Yes, you are not educated. So things that they are doing, we say those people sometimes at the restaurant and pub, they shouldn't allow someone to smoke for me to inhale the because secondhand smoke is dangerous than the person smoking. So why will you be smoking and I should be inhaling it? It's supposed to be illegal, but they do it. So just take care of yourself.
The first time I call, I think Inshra Bakojo. The first time I call, me kucha. Lewin name be a ucha or it made like entered. I couldn't.
You can't.
Begina bonte. Me will be peer, not at the action.
Now, when they increase dialysis, they are making noise. They increase that one, they are not getting. But when they use the money to buy shisha, that one, nobody make noise.
I know they are at home.
I'm not saying, what's your business?
Okay, Doc. It's a patch of the treatment, not face or advice. Then we go. And then you advise for the youth for this Christmas. A lot will happen. Some have started happening. Now, maybe can't laughing gas. And I'm praying to God, say, it shouldn't increase because the number of people I've seen enjoying this laughing gas in the balloons. You know. Doc, nina symptoms no account be boa no may be nyasa mitral valve stenosis and co.
Well, you see, my American attraction is say, "Oh, you are ready yet? Obi inform Obi." no matter how you love your husband, no matter how your husband loves you, if you mistakenly get sick, he can never take your medicine on your behalf. And see that. Oh, husband may be ama, but on to me no a draw. Emma wo honto and see. So your life is your personal property. If you joke with it, sure, you not value your health. Oh, and that will be yari. I would that form. Sometimes na mo call na mo interview mo omo yari omo bed ready for 3 years 4 years or da fa ko netu nyina ye kuro eno mo a anka mo woska yari bi ntino mo ska nyina some to turn properties nyina no. You value the importance of health, especially when you are a youth, because of to certify obi daughter for some 10 minutes 15 minutes into no how course the size nyama mixing nyama no
afra
Penifo go say akola de o peni beku
na mom video
to ba ne de o so da go fie ba wo mom no be bre
maye Rako se openi ni akwala beku o na mom akwala no video na obete no bro nya emu do ka ma ate ase sa MSE aye mitral valve stenosis eye niema bebre yare bebre ene kofaba na se niema bebre ne kofaba waka ye aduane die ene ye lifestyle obobo niema bebre so obo shisha so enim so obo so obi amuna obi bu afu ne chiri because Christmas yi ode be ye adwuma ode be mankrofo amankrofo ahyehye na onu so anya ne sika wo awo kwa akono mu no ye careful bisa ho se ne era omu no a wo pupie no ni nyina na apie eno eye one question aduane na wo kodi no anase Christmas yi mu ube out a ube call una ebusuya oni nanfofo parties a ube call na de wedding ne keka ho enuane na wo kodi no die ne ye de no aye emu niema angwa ene ne keka ho no wo di awie no edro be na wo fampo dia cleanse system nim ama umu ada ho kakra obi wo ho a onimu nsa no mo nsoso onimu ne papa enso Christmas we no obeto mu ntentan bie no different brands assorted wo benonom wo di Christmas ne wie a wo ba be sayare ye mpene sa afi 2024 a ye be remu no internasem America nyina ne say stay safe ene abusua wotimpie na emom ne emu bedi no ya amonhwe ne era wanumu no ya ma wani enko ho se ne ebe ya wo bedi Christmas ne be wie no na still apomuden pa no oda so ekremu doc ye beda wase papa pase eto nsafre wo baye ene ye ne Dr. Philip Ope ena etwetwe enkomo na obestre ye disamiri me hwe ne me bebre ka enye ono aka me ne mu se shisha ye de ta a ye ko ta ene ye ate ne mesua eti no me gina me ko me na be bi no obi shi bi na se me ko fa ka we na me no opugu me so metimi dwane ja no because sometimes it has a very sweet scented
once I didn't essentium
yeah
down no aroma
yeah
something and then if gas oil and then smoke no ban and then the tar on produce black we know open experiment to French and be experiment to see how you can separate smoke from water.
Wow.
Yeah
and I
my Jaffa Society.
And obi experience am obi experience.
Oh yeah.
Okay. It's ni nyina na ye nhwe na ye njai. Apomuden hu hia, apomuden hu odin, apomuden boye din. Enti se na oka ye no, ne o se omo ka ntam no. O se ma waduane enye waduro na waduro nye waduane de a. Ene ene yesoso ye ka ne saa. Ebe make sure say ye aduane be ye nduro, ne ye nduro soso aye ye nduane. Hamata abremu ne ye wo mpacho eja gas ne ne keka ho. yemma ya dwen koso yemma nkete no so yentan show mo long sleeves na fe yemma pomade na se nkuto ma menka ne sa yemma nkuto entimi mofra no skin no na abribium skin no entimi enna ho enfa emmaye na yenhyehyɛ nkwala nketo no babies no yenhyehyɛ omo nema na omo nye kuntan kakra long sleeves and I say bibia be kata omo ho free hamatan no ene awo ne ho se na ebe ya mofra no enkofa yare foforo enfa emeto won ho so midi e de Kyeamehemaa Adwoa Asaah nyame ya adoma bronya edi bronya ni wie 2024 ye be san abehiem e wa hanom memene da e betwa repeat na afi yesi 2024 mu ne ye back January the whole of health matters ye rebranding into near about 2024 ne dear aerobics womu walk womu into patcho prepare yourself for nyame adoma next year programs are ye ba enye health matters nko Adwoa TV the whole programs are ye Adwoa TV nyina no ye de ne efe na ye be polish so na so ne nyina ebe eka ho ade amo nyame nhira wo se afemu ne nyina waka Adwoa TV adwumakuo ne ho anase TV ne ho na dwumadi ade bremu nyina so no esomo ani na mo kire odo ema yense na yi kire mo ewo TV ne so no eye kama aha menya calls bebre omo kire programs obi a kire programs nani eje ho nyame nhira mo Adwoa TV yese yedamo ase papa ese maka ye ho fie bebre yi mu na mo ne yen eto kese sponsors enso nyame nhira me pa chawo se opese wo ne yen edidwa and also person be sponsor yen away all any of the program nim be it health matters your morning show any other programs so na ema no enha wo de 229 na bra Adwoa TV hanomo ye wo John Evans Atamils High Street no eso Holy Trinity Cathedral no Bishop's Court eho ena yewo anasa wo de woni mumpo a wodru post office aka se wo ko outcast school ni mu a obia be kyerɛw ama wo de wani akyerɛ hanomo anasa wo de frɛ me ankasa Kyeamehemaa me ankasa memo e wo 0544 133530 na enemento kese na fe yen kasa ketu abi ekita wo bia na ye be som na agi wo wa tu na ya ma wo package a eye kama kwan bia ye be fa so a ye be bɔ wo dawuro wo dwatan de hu dawuro ama wo so so anya atofo no ye be fa so say float kra na ye be kɔ e de ama wonti se na ye be ya won so benya sika na wo de abe sponsor your programs nyame onka mo ho no mo ye nyina ye ho ban onfa ye nkɔ enkotwa 2023 ni ye 2024 mu ahoɔden ene enegye mu na afe ye be hye mu so so a wasan so akoso abɔ ye ho ban ahwɛ ye nso midi e de Kyeamehemaa Adwoa Asaah nyame ye adom a 20